please welcome the Health 2.0 Developer Challenge team.
All right. Hello, everyone. I'm Jean-Luc Neptune. Again, as mentioned before, I'm Senior Vice President at Health 2.0. I'm responsible for the Health 2.0 Developer Challenge. And we wanted to tell you a little bit more about what we do here. So again, we'll talk a little bit about the Developer Challenge. I think the best way to tell our story is to have the people who are running this program tell that story. So with me, I have Hemali, Jen, and Graeme, integral parts of the team that is actually run out of New York. That's why we're very cool. If you could advance the next slide. So it's hard to believe that in 4 years, we've accomplished so much. We've run more than 65 challenges. We've either given away or allocated to give away about $4.5 million in prizes. Actually, we're soon going to be over 5 million. We've engaged a community of 25,000 plus innovators and technologists, and we've had over 1,500 teams participating in our innovation competitions. We've had an opportunity to work with really cutting-edge, innovative organizations, both nonprofit, for-profit. We've worked with the federal government and state governments, and you heard some of the organizations that we're working with today announce some of their challenges. I could spend all day telling you about what we do, but the key thing to understand is that we make it really easy for sponsor organizations to run innovation competitions. We wrap everything up in a bundle. We make it easy from beginning to end. And if you'd like to learn more about what we do and if you'd like to work with us, you can contact any of us or find us after this segment. So with that, I think the best way to talk about what we do is to actually talk about specific projects. And we're going to talk about 3. We're going to talk about the Pilot Health Tech NYC program, which is a great example of how challenges can drive commercialization. Hemali will talk about that. We're going to talk about the Allscripts Challenge, which is a great example of how sponsors can use our challenges to drive product development. And Jen Stone will talk about that. And then finally, Graeme will talk about the Blue Button Co-Design Challenge, which is a great example of how we collaborate with other organizations. And with that, Hemali, let's talk about Pilot Health Tech.
Thanks, JL. So as you know, it's really hard to pilot a technology in the provider setting. So that's why we worked with the New York City Economic Development Corporation to launch Pilot Health Tech NYC, a program that brings together the innovative technology companies, we call the innovators, with leading healthcare stakeholders, or the providers, or we call them the hosts. And we held a number of virtual and in-person matchmaking sessions to allow them to collaborate and work together on pilot projects. And the hook was that we were awarding $1 million to 10 pilot projects who would receive $100,000 each. Those programs are now underway. And with that, we had a number of leading healthcare organizations who participated in the pilot program, including the New York Presbyterians, North Shore LIJ, Mount Sinai, and many more. We had a lot of interest with 250 innovator applications who sort of competed to meet with these 25 host organizations that were in our network. We held 2 days of in-person matchmaking sessions that were sort of 15-minute roundtable discussions. And together, they collaborated to jointly apply into the program. They had to basically come up with a pilot together. And we had 41 full pilot proposals between these hosts and innovators. We awarded 10 pilot programs with $100,000 each to offset the cost of the pilots. That $100,000 could be split between the host and the innovator. And now the pilots are underway, and we're really excited to tell you about the results in the next year. They're going to be about 3 to 6 months long. So with that, I'm going to hand it off to Jen, who's going to talk to you about the Allscripts developer platform.
Thanks, Molly. So the Allscripts Open App Challenge was sponsored by Allscripts, which is a leading EHR company in the space that's transitioning to a strategy of open innovation. So Allscripts realized that in partnering with Health 2.0, they could expand their developer community and build out their EHR software. So the challenge asked developers to integrate with Allscripts API to build an app that supported healthcare physicians in improving patient outcomes. The challenge ran for 1 year. It was 2 phases. We had 100 submissions and $750,000 in prizes. And with that, it was our biggest challenge yet. The challenge was very much successful. It enhanced the Allscripts EHR product with new apps that could be sold in the Allscripts App Store and Exchange. It grew the developer network, engaging them with the Allscripts API. It refined the Allscripts developer program with feedback from that network. And it positioned Allscripts as an innovation leader, proving to be a model for other companies in this space. And so with that, I'd like to pass it to Graeme Ossey to talk about Blue Button Plus.
Thanks, Jen. So the Blue Button Co-Design Challenge was part of the Investing in Innovation initiative that the ONC sponsored and ran 24 challenges with us. In this challenge, we brought together partners from the ONC and our friends at Health Tech Hatch to really engage patients in the product development process. So throughout the challenge, we did a number of things to both help the innovators and engage patients. We had the patients submit ideas for apps that they wanted built that would connect with their medical records through Blue Button Plus. They voted on the apps to validate the best ideas. And then we brought experts in Blue Button Plus from the White House and from other organizations to help the innovators integrate their solutions with Blue Button Plus. We then had the patients on Health Tech Hatch test and give feedback to the apps and to the app developers so that they could really target their product towards the end user. And in the end, we had public voting and judging to pick our winners. And with that, we have live Blue Button Plus enabled apps. So during the challenge, patient empowerment was a huge deal. They were involved in the process. They voted 6,000 times, gave us 73 ideas for new apps that they wanted, and we engaged 2.5 million of them on social media. In the end, we really engaged patients. They tested the apps, and we have a lot more Blue Button Plus enabled apps in the environment. Jill, I'll give it back to you.
All right, thank you. So, we had 5 minutes. I think we went a little over to tell you about what we do, but we're doing really fascinating things with the Challenge program. We've moved beyond simple prize competitions, and we're mutating the program and covering a lot of really interesting things and providing our development community as a resource to sponsor organizations. So if you'd like to learn more, you can reach me directly. I'm jl@healthucon.com. That's my personal mobile number, 646-734-2320. If you'd like to learn more about the specific programs, you can go to our website, www.health2challenge.com, www.health2challenge.com. And again, Graeme, Jen, Hemali, and I will be circulating about, and if you'd like to talk to us more, we're happy to tell you about what we're doing. Thank you.